Welcome back to the final portion of this chapter. And in this final portion, we're going to be just reviewing what we learned and making sure that we're able to apply that information as we're learning other medications from other systems. So we started out the chapter by talking about pharmacokinetics. The pharmacokinetics is the absorption, the distribution, the metabolism, and the excretion. And we use the medication called Omeprazole as the example. And although I wasn't asking you to memorize everything about the pharmacokinetics of Omeprazole, we learned a lot of terms and we learned how to understand when someone was talking about the pharmacokinetics of any medication. So we can apply that information directly to when someone else is talking about pharmacokinetics. And after that pharmacokinetics review, we investigated a little bit more about pharmacodynamics. And pharmacodynamics is the mechanisms, basically the mechanisms by which drugs act. And we were taking a look at the enzymatic inhibitors. We said that the main thing that we were to put in our mind is to try to figure out whether the enzymatic inhibitor was a reversible inhibitor or whether it was an irreversible inhibitor. And then the reversible inhibitors, we further divided them into subclasses, the most important of which were the competitive inhibitors and the non-competitive inhibitors. The most common type of enzymatic inhibition involves competitive inhibition, in which the medication binds to the active site of the enzyme and prevents the actions of that enzyme. Obviously, we don't take a large enough dose of that medication to bind all of the enzymes, so there's still some activity of the enzyme involved. The medication is simply competing for the active site, and when the medication is not in the active site, but the substrate is, the enzyme is going to be doing its job. We also looked at a few examples of irreversible inhibition. In that case, the medication or toxin will normally bind covalently in a very, very strong bond at the active site of the enzyme. That is not always the case, but in most instances, it is a covalent bond, and in most instances, it is bonding to the active site of the enzyme. From that explanation, you can see that irreversible inhibition of an enzyme can be very dangerous and even fatal. But it's also the type of inhibition that's involved in omeprazole and other proton pump inhibitors. That's also the reason that despite the fact that omeprazole has a half-life of just about 1.5 hours, it has a duration of action in the body that lasts up to 72 hours. The reason that proton pump inhibitors are not associated with life-threatening effects has to do with the fact that it's affecting an enzyme that's only used in 2 places in the body. We furthered our discussions of enzymatic inhibitors by discussing medications that have drug-to-drug reactions because of the fact that they inadvertently affect an enzyme that metabolizes other drugs. When you hear something that affects one of the Cytochrome P450 enzymes or one of the CYP enzymes, it's your cue to find out if the client is on any other medications, and if so, whether that medication is contraindicated for use with the medication that affects the liver enzymes. We also briefly discussed the pregnancy categories, finding that pregnancy category D or E are potentially so harmful to the growing fetus that the woman of childbearing age should be taken off the medication even if she's not considering getting pregnant. And meanwhile, the pregnancy category A is the very best category, and you should not expect any adverse effects on the growing fetus. And finally, we discussed the indications, contraindications, mechanisms of action, and the side effects of the proton pump inhibitors. But we also use that section to emphasize that no matter how benign the condition was that prompted the person to be prescribed a medication, we should not just suggest to the client that they go off that medication without first getting all the details. For instance, the person who is on proton pump inhibitors may say that they're on them because of gastroesophageal reflux disease, but they really were put on the medication for a precancerous disease called Barrett's esophagus. And the person who has Barrett's disease needs to make sure that there's no acid that's splashing up into their esophagus. Otherwise, their condition can progress to esophageal cancer. So, what we have left is just one last chapter in our Understanding Medications course. And in that chapter, we're going to look at neurotransmitters, and specifically neurotransmitters that are involved in the process of emesis or vomiting. But that information is going to be able to be applied to any of the medications that affect neurotransmitters. So this is a really interesting chapter coming up, and I'm really hoping you enjoy it. We'll see you there.